just, because you talked about evidence, Atif. So if you look at the state that's had pricing transparency the longest and in a way that's understandable to consumers and showing differences is a state in New Hampshire. And I think they did finally publish a report that shows that there had been no effect in prices going up as a result of the transparency. What they did show, and I think that's a good thing, is that the variability decreased tremendously. And more recently, on an anecdotal level, Blue Cross and Blue Shield of North Carolina, I think, has come out with probably what is the most aggressive and well-done transparency tool on pricing. You can go, anyone can go, you don't have to be a plan member, so you don't have to enroll your employees if you're a hospital into Blue Cross and Blue Shield. You can have, that information is freely accessible on the web, and they show full episode costs for a number of things, the comparisons between the hospitals, and the anecdotal part is that the response from the more expensive providers was almost immediately to try to find a way to renegotiate rates. And we saw that also with Jamie Robinson's study with CalPERS on as soon as that transparency was out there and consumers were at risk, suddenly the more expensive facilities called and said, let's renegotiate.
With the reference pricing.
Yeah, so I think that there is actually a fair amount of evidence that, yeah, those who are being paid less today might want a little bit more, but it's really on the higher end of the scale that they're getting very worried about the current movement to it, and that's a good thing.
Mm-hmm.
I think that's a great point, especially as products are being developed with more cost in mind. There are providers, whether it's a hospital or physician, that don't want to be left out of those things. So nobody wants to be that outlier one way or the other. So I agree. I think it's going to end up toward the center.
So in the spirit of, last segment we talked about potential excuses. Sometimes antitrust law are used as sort of reasons for squashing transparency. And I'm guessing that's something that you all have heard before. Any legitimacy to antitrust concerns when we think about price transparency?
No.
Definitively. No.
Look, all the arguments that have been put forth are bogus, and the reason you know they're bogus is because if they truly did violate a federal statute in a way that the current stakeholders felt was seriously impinging on their ability to do business in one way or another, or they violated consumer rights, the lawsuits would have gone up to the Supreme Court by now, and they haven't and they won't because there's absolutely no legal standing for these arguments.
Great.
I would say that I have a level of concern, but it's outweighed by what is a greater good of the benefit of transparency and having it out there. So yes, I'll take the risk of the leverage that could be exerted because the benefit, I think, is that big, that important. Yeah.
Great. Well, I think